This resource contains important stories and conversations about female genital mutilation or cutting. Support is available on the NETFA website. Please go to netfa.com.au. Before we begin, I would like to acknowledge that I'm joining you all today from Meanjin in Queensland. I would also like to pay respects to the elders past and present. Today we are joined by a very special guest, Dr. Rachel, who will be sharing her experience supporting women affected by FGMC. So, Dr. Rachel, can you please tell us your full name and a little bit about who you are?
Sure, thank you. So I'm Rachel Claydon and I'm a GP, and I've been a GP for over 20 years. And I work at the Mater Refugee Complex Care Clinic and with the Refugee Health Network of Queensland. And we see people who've recently arrived to Australia, but also people and women with more complex health needs at our clinic.
Can you please tell us a little bit about your role supporting culturally and linguistically diverse women, including those who are affected by FGMC?
Yeah, so in our clinic we see women and from many diverse backgrounds. And we tend to see women particularly who don't have Medicare and who can't necessarily access other general practice services. And, quite often we care for women throughout their pregnancies and throughout, their whole life journey of being a woman and their different health needs at the time. And, through that work we do see women quite often who have experienced FGMC in the past, and we provide care for them.
Do you think enough is being done to support women who have experienced FGMC, especially during their pregnancy and childbirth? And if you can elaborate on your answer, please.
I think some of that really depends on where women go for their care. It depends as well on the individual clinicians, doctors, nurses, and other staff who are caring for them. I know in some states of Australia there are dedicated centres that provide, really good wraparound care for women who have experienced FGMC. We don't have such a dedicated service in Queensland, but I do know that there are, many midwives, obstetricians, and other GPs who work really well to support these women. I do think, though, across the board, that there's still a lot of clinicians who perhaps don't think about it, who don't necessarily consider that some of the women that they see as patients might have experienced this. So I think, and sometimes I think some clinicians also don't necessarily feel comfortable talking to women or don't know how to do it in the right way. So I think there's still a long way to go.
Why do you think it's important to give tailored care and support for pregnant women who have been affected by FGMC?
I think firstly because, particularly during pregnancy, pregnancy can be, a time where women feel afraid, they're not sure what's going to happen next. They want everything to go well. They want to have the best experience that they can during their pregnancy and delivery. And for some women who have experienced female cutting, they may not see that necessarily as an issue. It might not be something that they even really think about a lot. But for other women, they might be really concerned, and they may have heard stories that some women haven't received, positive care in their pregnancies. So I think it's really important that, we're able to talk to women about this experience and that we're able to reassure women that we're there to assist them throughout their pregnancy and birth so that they can have, the best possible pregnancy and birth.
Yeah.
I also think that I guess probably depending where you work in Australia, that some services perhaps aren't so used to seeing women who've had this experience and perhaps don't know, the best way to listen to and work with women. And, I think as well from a community point of view, if we can provide really good care, then I think we're providing good care to the community and, across the board.
And what are the 3 challenges that health professionals face when they're trying to create a positive experience for pregnant women in their clinics or at the hospitals who have been affected by FGMC?
Yeah. Look, I think first up again, it probably depends where you work, and initially, if your service is actually welcoming overall and is sort of open to learning about other people's cultural experiences as well and their backgrounds. One of the biggest challenges I would say though is if clinicians don't feel that they have enough knowledge or enough experience. I think that can make them feel a bit anxious, and that can come across to women. And I think also not knowing what to do. So if a woman, discloses that they've had this done and they might have questions about how that will affect their pregnancy and birthing, I think some clinicians don't feel adequate, that they have enough adequate knowledge and training to be able to necessarily answer those questions. I also think that there's limitations in knowing where we can refer women, particularly in terms of knowing that they will get culturally safe care and be listened to in, a tertiary service. So I think that is one thing, but also there's not always clear sort of referral pathways. Like I said before, we don't have a dedicated FGMC service in Queensland. So I think they're probably the biggest challenges, I would say.
Why do you think it's important to listen to the women who have been affected by FGMC, especially during their childbirth experience?
Yeah. Do you mean during birth? I guess during their birth experience, yes. Well, I guess women know their own bodies and what feels normal and right for their bodies. I think that it's important to listen to choices. So, in some situations, for example, some women, depending on the type of FGMC they've experienced, might decide to have a defibrillation, prior to birth. Some would rather wait during the birthing process. I think it's being respectful about the choices. I think during the birthing process, it's a really vulnerable time when you're birthing, you feel vulnerable. So I think it's really important to actively listen to try and, relieve some of that vulnerability. I think also too, for some women, sometimes the birth process can bring back trauma experiences. So, being sort of aware and listening to a woman if she's experiencing that, I think that's really important. Also because that we want her to have a positive experience of birthing and a safe experience would be what,
In your experience, what are the 3 things that doctors and other health professionals need to know when they're looking after pregnant women who have experienced FGMC?
I think firstly, to actually think about it, to think about that it could be a possibility, because not all women will raise it themselves. And that could be for a number of reasons, that they may not see it as an issue. It's part of something that happened to them. It's not, who they are. It doesn't define them. So they might not raise it for that reason. Or they may not raise it because they don't feel comfortable or trusting, So I think firstly, just to be aware and think about it as a possibility. I think the second thing is not to be afraid or hesitant to discuss it. And sometimes, one way of doing that might be to say to a woman, I care for lots of people coming through clinic, and I know that some of them before have experienced circumcision or cutting, and I always ask about that to make sure that, we can care in the best possible way for pregnancy and birth. So, I'm just asking you now, is that something that you've been through or experienced? So I think certainly think about it, raise it, ask about it, but be very mindful that, it might take some visits and a lot of building up of trust for a woman to tell you about her experiences and how that's potentially affected her. So I think that's probably 3 things. And I think just making sure that, we're also not judgmental and we understand, the cultural context in which this has occurred.
Mm. So you said before that there's not quite a lot of resources available, especially in Queensland. So what resources have you come across that are currently accessible for health professionals such as yourself to support these women?
Yeah, there's some really good resources made by True Reproduction and Health, and they have some modules online that are really helpful, particularly with hearing women's stories and helping doctors and clinicians to think about how to speak with women appropriately. So they are really good resources. And the Refugee Health Network of Queensland also has some resources online. I will often also borrow things from other states, and some other states have resources that you can also share with women, throughout their journey.